All right, I think we should get going.
Mm. Okay. So I would say good morning everyone. Right now it's about 5 o'clock in Los Angeles. And I want to first of all thank Dr. Primary for your effort on coordinating such a uh, remarkable lineup for this APEC briefing session on burns. My name is Kevin Xu. I'm the CEO and president of Mabel, and also currently serve as the co-chair of this year's APEC Summit. So compared to the past, this year we want to do something that's a little bit different. Normally for APEC Summit, we're promoting trade and partnership. But this year, we're talking about more things. That we want to take this opportunity to build a platform where we can hear a voice from people who work in other industry, in other sectors, especially nonprofit organization, NGO, and medical association. We want to talk about the topic where it actually is most relevant to people's on the front line. And this year's theme for the APEC is about how to build a resilient and sustainable future for all of the APEC economies. And I think this briefing session is extremely important. And this entire session will be fully recorded and then send it to the protocol office of the APEC committees. And we hope to carry on the dialogue and continue to creating resonance among all the APEC members to make big difference. Thank you.
Okay, let's share. And I'd like to thank Kevin and all my speakers for agreeing to this Congress. Can everybody see my screen?
Yeah.
Okay.
Yeah,
burn injury is one of those things that happens worldwide and impacts every country in the APEC area, and it is a real challenge to creating that resilient and sustainable future in the world. And there's a lot more media now than there used to be. Things get advertised more, and so you have to ask yourself the question: are we just seeing more ads about fires and disasters and injuries, or are we just kind of imagining it? Well, this is the incidence of burn disasters between 1990 and 2000. This is between this and 2015. And in the last 8 years, all of these bubbles would explode. The number of disasters has increased astronomically. And it highlights many of the things that are causing issues in our countries. This is Maui. This happened last week. Burn injury and the events surrounding that are real events. They happen now, and they're going to happen in the future. And it's not just an American problem. It's not just an Australian problem. It's not just an Asian problem. It encompasses all of our regions. And this is a heat map from the WHO of the distribution of estimated deaths from fire. And you can see it's worldwide and centered in APEC countries. If you look at some fire statistics, the average number of burn-related deaths per 100,000 inhabitants is actually highest in Russia. But when you look at per distribution of the deaths, India and China have the two highest numbers of deaths per 100,000 due to fire and heat. This is a really big problem for APEC, and it's something that we have to address. So the objectives of this conference are to understand the landscape of burn injury and in socioeconomic landscape in APEC countries, to talk about some of the gaps in care that each of our countries have, and to identify some opportunities to address the global burden of injury. And we have some incredible speakers lined up. Dr. Cortado is the current president of the American Burn Association. He's also a well-known burn surgeon from Toronto. Dr. Rollins is a specialist burns and plastic surgeon in Perth, Western Australia, and he's current president of the Australia and New Zealand Burn Association. Dr. Ahuja from India is the first person in the developing world to become president of the ISBI in over 70 years of the society. And 25 years ago, he brought to the forefront the problems that India has and the difficulty of burn management. He's remained focused on galvanizing resource personnel in the Asia Pacific region, and it helped form the Asian Pacific Burn Association in 2009. He's currently an advocate for philanthropy, founded a burn healing foundation to provide correction of surgical post-burn deformities. Dr. Lo is the chief surgeon in the military hospital in Chongqing, China. Dr. Sjoberg is the current International Society of Burn Injury president, and he's also professor and burn director in Linköping, Sweden. Dr. Miranda is a plastic surgeon and chief of pediatrics burn unit in Guadalajara, Mexico, and he's also the current ISBI secretary. And I work at Shriners Northern California, and I'm the burn chief at UC Davis. And I'm past president of the American Burn Association. So we have quite the lineup here today. And I am going to cease my comments so that you can hear from my colleagues. Dr. Cartado, you're up first.
I'm just going to share here for a second. Can you see my slides? Okay. Thank you very much for that kind introduction, Tina. I work in Toronto, Canada, at Canada's largest burn care facility, and I've been asked to talk about the status, trends, and economic considerations related to burn injuries and burn care in Canada. However, nothing of what I'm about to tell you will be meaningful without first telling you a real patient story.
So
John was immersed.
Rob, before you get going, you're showing your notes to us.
I don't want to do that. Sorry, guys.
So just put your there.
What are you seeing now?
Just you.
Okay. I'm going to stop. Really sorry about that.
No worries. We were just reading your thoughts.
Yeah. Now are you seeing just?
Yes, now we've got it. Thank you.
Okay.
Go ahead and start from the beginning. That's fine.
I'm going to go back to the beginning.
Yeah.
Sorry about that, guys. Okay, you're seeing just my PowerPoint,
yes,
correct?
Just got your
Not
slides.
my notes. Okay. All right. Thank you for that kind introduction. I work in Canada's largest burn care facility. I've been asked to talk about the status, trends, and economic considerations related to burn injuries and burn care in Canada. However, nothing about what I'm about to tell you will be meaningful without first telling you a real patient's story. John was immersed in hot molten tar when his tanker truck rolled over in an accident. He sustained third-degree burns to nearly 60% of his body. At 41 years of age and at midpoint of his career, his life was permanently altered on that day. He spent 167 days in our burn unit and another 3 months in inpatient rehabilitation. He underwent 12 major skin grafting operations. Several of his fingers were amputated. He survived 4 major bloodstream infections, lung failure, multiple episodes of pneumonia, and he was on a ventilator for a total of 3 months. John survived, but that is not the end of the story because burns are a chronic condition. For years and even decades after a major burn injury, our survivors, including John, suffer from impaired movement, chronic pain, neurologic problems, diabetes, altered sleep, and importantly, mental illness. Reintegration back into the workforce and society at large is impaired or it just doesn't happen. In economic terms, John's acute hospitalization cost alone was approximately $500,000 US. More important, the number of years life productivity lost, in this case due to disability, is 39 years. This is a statistic we refer to as a DALY, disability adjusted life years. Please reflect on what 39 years of lost life means. Many patients have burns that are less severe than John's, but the long-term physical and mental health impacts and impacts on productivity are no less profound. Now, across my country in 21-22, there were 25,000 visits to the emergency room for burns, and 2,500 patients were admitted to the hospital for a burn injury. Relative to other countries, we see fewer burns, which is a reflection of our smaller population relative to our large landmass. Now, we don't have robust data for Canada specifically, but global burden of disease data shows that burns disproportionately affect younger people, many in the prime of their productivity. Canada is a high socio-demographic index country shown in the green line, and this conforms to the global pattern of injury. The message is that younger people bear the burden of burn injury. In 2019 worldwide, the burden of burn injury measured in DALYs was 7.5 million years. About 2/3 of that was due to death from the burn and about 1/3 from long disability from the burn injury. Interestingly, DALYs due to burn injury in Canada look very much like other parts of the world, and that should be a reminder that no matter where you live, burn injury frequently leads to loss of productive life years. Unlike many parts of the world, Canada fortunately has seen a decreasing percent annual change in DALYs over the last 2 decades. One disturbing trend in the global data after many years of minimally fluctuating numbers is a rise in the number of burn incidents since 2016. Some of my colleagues and I have observed this trend. In Toronto, only midway into 2023, we've already seen 70% of the number of burn admissions we saw in 21 and 2022. And in Calgary, Alberta, that percentage is up to 96%. We're seeing more fires nationally, and we think there are 2 important contributors to this trend. The first is rising homelessness, necessitating the use of temporary shelters and substandard housing, with the associated fires due to the need for heat. Second are rising rates of alcohol and substance abuse, another factor we know is closely tied to burn injury. A third, but unquantified factor on the horizon are burns from climate change-induced wildfires. Although there were fortunately no burn injuries, Yellowknife, a city of 20,000 people in our Northwest Territories, had to be evacuated just this month because of advancing wildfires. Inevitably, burn injuries will occur from these causes. In Canada, the resources to care for burn injuries are small and getting thinner. There are 10 specialized burn units in Canada. They're staffed by an aging population of burn surgeons, and the number of specialized burn nurses, which are the backbone of our burn care team, is dwindling because of aging and post-pandemic burnout. And so I can summarize all of this with really one statement and a question. The first is that burns take a massive human personal toll and pose a large economic burden. And are we prepared? Thank you.
Thank you very much, Dr. Cartato, for the Canadian perspective. Dr. Rollins, you are next to give us the perspective from the Australia-New Zealand axis.
Okay, just bear with me right here.
It's the joy of screen sharing.
It is. And just
don't make the mistake I made.
Well, I won't. I'll try not to. But yeah, it's not wanting to do that. One sec. Let's have a look. Right, we're getting there.
You're winding down in Australia. We're winding up.
It feels that way. It feels that way. Okay. Right. There is hope.
There we go.
Now, hopefully you can see my screen.
Yes.
Sorry about the delay. Thank you very much indeed for the opportunity. Just a few words from Australia, New Zealand, really, on my take on what I've sort of summarised as the natural and national disasters, and looking at that with respect to an economic picture with respect to burn injuries. Here in Australia, we have the very pleasant and historical tradition of acknowledging the traditional landowners of this country, and I'm currently sitting here in Perth in Western Australia, which is Whadjuk Noongar country, and it's in doing so we pay our respects to those original land holders in this country. I'm going to talk a little bit about our nations, and I represent both Australia and New Zealand with respect to the Australia and New Zealand Burn Association. And just for some context, of course, the Australia and New Zealand Burn Association really advocates not only for clinicians working in burn care, but of course for our patients, and with our key pillars being clinical care, prevention of burns, burn education, and of course, research as well. And as we've heard already, each of our various areas across the APEC regions have our challenges, and I think opportunities to improve things for those patients with burn injury. So one of the things that I think is unique about burns is that every single one of us who are participating in this forum, and everyone who watches this forum when it's been recorded, will have experienced a burn. Every single one of us will recall the pain and the inconvenience of having a burn injury in the kitchen, in the garage, and at work. And so this is real. Every one of us has had a burn. It may have been small, or it may have even been larger, and you'll appreciate the complexities, and as we've heard from Dr. Colato, a significant amount of lost work and the associated costs of the burn when those burn injuries get bigger. So here's my thumb on the 23rd of December, 2021. I got a scald injury at work. I did good first aid. I applied a silver dressing, but then I was off work. I was off work for the rest of the day. And economically, that economic toll started to tick. The following day, I was due to have an all-day operating list, which was cancelled. And that, of course, has economic implications for me as an individual, but also for those patients who were supposed to be operated on that day that got cancelled and then had to reschedule. And of course, for our hospital, who then couldn't fill that list and therefore economically was at a loss on that day. And then finally, on Christmas Day, I wasn't able to leap in the ocean with my children and my dog. I was the one taking the photographs, albeit with a bandage on my thumb. So the implications for burn injuries in the economy are real, and they're real not just for that big 60 or 70% burn, but for that small injury affecting otherwise healthy individual. So there is that loss of income to the individual and to society, and I think the whole host of other aspects and the world at large. But what about these natural and national disasters that I've talked about? And what I mean by that is these sorts of events. And these sorts of events we've heard John talk about as well. On the left there, that's the White Island volcano that erupted and really brought Australia and New Zealand together as we battled to save the lives of those patients who were able to escape. But tragically, of course, a number of people lost their lives. And then the other photograph, of course, again, we've heard about it already this evening, the bushfires that we seem to have in increasing numbers every summer here in the Southern Hemisphere, causing significant economic and social problems. So we see loss of housing, we see loss of infrastructure, schooling, hospitals, and of course, tragically, we see patients getting burnt. And not only are those residents where those areas have been bushfires, but of course, those firefighters can get burnt as well. And sadly, some even lose their lives. What about the national disasters? Well, one of the national pastimes of many countries, and of course, Australia being no different, is of course the barbecue. And it's in some ways a national pastime here that the barbecue is reigning supreme all through the year. And it's a tragedy that the barbecue is responsible for so many burn injuries that, of course, again, have huge economic implications for our patients. And this is just a snapshot of patients from our brands registry from 20 to 21. And as you can see there, lots of these burn injuries are happening in young individuals of working age, in males, and many of these occurring at the weekend associated with accelerants onto barbecues and often mixed with alcohol and drug use. So the epidemic, I suppose, with respect to our burns focuses, I think, on those natural disasters and the national disasters that we face here in Australia and New Zealand. And for completeness, this is our brands database, which is available online. And I'd encourage people to look at that in terms of looking at our snapshot with respect to the economic, but also some of the sociological impacts of burn injury across our two countries. So to conclude, I think action should definitely be on climate change, as we've heard, and therefore an attempt to reduce the bushfires that we see each year, advocating for safe and sensible behaviour at those barbies. And I think in that way, we'll really help our understanding of how these burn injuries impact our patients and indeed our burn services in a very meaningful way. So thank you very much.
Thank you so much for providing the Australian perspective. And now we turn to India. Dr. Ahuja.
Yes. So thank you very much, Kevin and Tina, for organizing this event during the APEC summit. I think this is a very important topic, especially for the developing world and the Southeast Asia. You have seen this map differently, which Dr. Pamiri presented on mortality statistics resulting from burns. So this is another kind which represents that if territories of the world are sized in proportion to the absolute number of people who died from fires in 1 year, you would think that the Indian subcontinent, Southeast Asia, is the burn capital of the world. And where the burn incidence is diminishing in US or in the developed world, and some of the good burn units are even closing down in US, we carry a huge burden of disease, burn disease, in the Indian subcontinent. These are from the burn fact sheet of WHO on the incidence and mortality. And it's about 1 million people are moderately or severely burnt every year in India. And if you have taken note of what Dr. Pamiri presented, that probably 23,000 deaths per 100,000 incidents of severe burns was reflected in India. So you can imagine how many more than 250,000 people would be dying in India every year alone from burns. 85%.
So Rajiv, your slides are not progressing.
Of these 85% of these burn injuries. Yes. Can you hear me?
Your slides are not progressing.
85% of the burn injuries, they happen in low and middle income countries, and 65% of them, they happen in Southeast Asia and Africa. This figure of 180,000 deaths, which WHO has reported worldwide, seems a little flawed. And we can, I'll show you this in the next slide as well.
Rajiv, your slides are not showing.
And 70% of the burn-related deaths in the Southeast Asia are females. The same document on disability and morbidity reports that 17% of the children with burns have a temporary disability from burns, 18% develop a permanent disability, and 5% of the disabled population in Nepal is from burns. If we extrapolate this to the Indian incidence, today we will cumulatively have 5 million disabled from burn injuries alone in our country, and that is a huge burden of disability in India. I have in the past presented this comparison between the American fact sheet from the American Burn Association and the Indian population, although we don't have a registry of burns in India, but this is just a plain simple extrapolation that India has 4 times the population of USA. And if USA is reporting an incidence of 45,000 admissions yearly, India would easily have 4 times that incidence of admissions. And that too of burns, 50% of whom are more than 50% of the body surface area, whereas in US, they admit 80% patients who are less than 20% body surface area. There's a huge disparity in the per capita income, and there's a huge disparity in the per capita income. And because of this, because burns is an injury of poverty, you will have so many more patients than by just the simple extrapolation. And if 40 to 50% of these people are dying, just a minute, Ariel is calling me. Yeah, Ariel. Oh, really? I'll just see. I'm just told that the slides are not progressing, so I'll just do it differently. Although they were changing here.
I would say start from the beginning, and we'll just edit the recording.
Can you see the slides now?
You're not on the slideshow.
I'm not on the slideshow, but when I put it on the slideshow, they were not progressing for some reason. I don't know.
No,
Is
you
it-
weren't. You never got to slideshow last time. Yeah, now they're going. I think you're going to have to click on the slides.
Can you see the slide now?
I can see it, but you're going to have to click on it on your next slide, Brett, because you're still not in slideshow.
Oh, it shows slideshow here on my screen.
Yeah. Just click on your slides. And I think it's going to work. So use your mouse to click on your second slide.
Yeah, that is what I'm going to do. I'm sorry, I'll start this again. Can you see the slideshow now?
Yeah. Can you click on your second slide so we make sure that it shows?
Yeah. Is it moving?
No.
No.
Not with us.
So
I don't.
take your mouse and just click on slide 2.
Can you see the slide now?
No. Only your
Right.
first one.
I think you need to have it not in the show mode, just the as you do when it's preview, and then pick each slide at a time.
It was working very well.
It works like that, but you have to do it that way.
I'll do it this way only if it is all right. Okay. If it
Yes,
is
that
working.
works fine. That's fantastic.
Okay. So
Do you want to start from the beginning? We'll start from the top.
I'll just start from here again. So if we just refer to the burn fact sheet from WHO, which was published in 2018, India will have 1 million people which are moderately and severely burnt every year in India. And if you had referred to what Dr. Pameri had presented according to the mortality, more than 23,000 per 100,000 patients were dying who were severely admitted with burns. So we should have more than 250,000 burn deaths annually, which is a huge amount of mortality in India. WHO reports that 85% of the burn injuries they take place in low and middle income countries, and 65% of them they happen in Southeast Asia and Africa. This figure, which WHO has reported about 180,000 deaths in India in the worldwide, obviously is underreported. 70% of these deaths they will occur in low and mid in females. The same document reporting on disability and morbidity shows that 17% of the children with burns they have a temporary disability, and 18% of these children will have a permanent disability. 5% of the disabled population in burns in Nepal is due to burns. And if we extrapolate these figures to the Indian population, the Indian burn burden would be a cumulative 5 million disabled from burn injuries today. I've been showing this comparison for a few years now. India doesn't have a registry of burns, but if we compare just with the population statistics with what American Burn Association has reported, we have a 4-time population of US. And if US reports 45,000 admissions, burn admissions annually, we should easily have more than 4 times that number. And that too, of 50% of the patients admitted would be more than 50% of the total body surface area burns. Whereas in US, you would have 80% patients who are less than 20% total body surface area. And since there is a huge gap in the income of the people in the two countries, and burn being an accident of poverty, you can imagine we will have a huge number of deaths taking place in this country. And that too, if all of them, they get admitted, we have just about 500 dedicated burn beds compared to 2,000 burn beds dedicated for burns in US. Through several of our publications in the beginning of this century, we have highlighted the extent of incidents in burn management and the conservative techniques that are generally used in burn management. We have also reported that there has been a slight decline over the last 2 decades in the incidence of burn trauma. And primarily this is because the government has been providing a piped liquefied petroleum gas in the kitchens instead of kerosene stoves, which are more safer. Thus, the challenge in burn management is that it is obviously not possible to provide ideal treatment to all burn victims in the developing world, which are based on the Western models. You have just heard Dr. Cortato saying it took $500,000 for treatment of one burn patient who was about 60% total body surface area burn. So it is known that burn management is cost intensive. It requires a prolonged hospitalization, and developing world has a resource crunch, and they don't have enough money to buy all the expensive consumables which are researched and developed in the Western world. Obviously, the government funding is inadequate because only 2% of the GDP is earmarked for entire health of the population. And medical insurance schemes are not affordable by vast majority of these poor people. So in short conclusion of the magnitude of the problems, there is a gravy train which is overloaded with people wanting to jump onto it. What is the future of burns management in India? In 2010, the government, at the initiative of few leaders, started a pilot program of National Program for Prevention and Management of Burn Injuries. This has expanded since then, and it has spread into several states, and it is on the move. But still, there is no central registry of burns which will tell us what is the exact number of burn patients who are getting admitted. We need to have more prevention programs and awareness campaigns from the government. And one very strange thing is that in India, there is no qualification in burns management. Only plastic surgeons are qualified to do burns management, and majority of them are interested in other spheres of plastic surgery rather than burn management. And most of the burn management is left to general surgeons who have had no training in burn management. We need to have more cost-effective treatment modalities, because all the research is done in the Western world, which by the time it comes to developing world is so expensive that people are not able to afford it. Above all, we need a lot of political sympathy, because nothing moves without political sympathy. ISB tried in 2009 to move a World Health Assembly resolution to recognize burn injuries as important, but the attempt failed, because if we have a WHO resolution, then the national governments will be compelled to focus their attention on this aspect. We also making a small contribution in India by starting a Burn Healing Foundation, which is an NGO which facilitates corrective surgery and provides all treatment costs to the poor patients. And this is a supplementary effort towards what the government is already doing. We provide support for rehabilitation through 19 partner hospitals all across India, and about 4 to 5 hospitals are joining as partners every year. The NGO is registered for income tax exemptions and for corporate social responsibility donations. So far in last 2 years, 60 patients have been treated successfully. Thank you very much.
Thank you, Dr. Ahuja, for your insights into India and its many challenges. Dr. Schoberg, you are next up and to discuss the worldwide impact of burns from the International Society Burn Injury perspective.
Thank you very much, Tina. Can you see my slides?
Yes, we can.
Okay. First of all, I would like to thank Tina and Kevin for arranging this APEC meeting and letting us present topics on burns. And as Dr. Palmieri was saying, I will then try to present ISBI, and that's the World Organization covering burn care and being a supportive organization on the world perspective. The International Society for Burn Injuries, it stands as a permanent global organization that is dedicated to the advancement of burn care. It was actually established in 1965, initiated by a group of medical professionals that all share the vision of fostering the progress of burn care practice on a worldwide scale. Over time, ISBI composition has evolved, transformed from primarily a physician-based and founded entity into a robust multidisciplinary consortium dedicated to addressing the complexities of burn injuries.
So, Folke, you're in the notes mode.
Yeah. Okay. Do you only see the notes? Maybe if I try the, can I do? Do you see this? Do you see my second slide?
That's perfect. That's perfect.
So now you have the slide about evolution and multidisciplinary approach.
Yes.
Okay. Perfect. So in my presentation, I really would like to underline the presentation of data that has been presented so successfully by Dr. Kartoto and Dr. Rajiv Ahuja, and it underlines the mission that the ISBI has. And the evolution of the organization has gone from primarily a doctor-oriented organization into a multidisciplinary approach. And the burn care trajectory has witnessed a significant transformation through the past century, particularly during the last couple of decades. Although initially spearheaded by doctors, as I said, it's now a multidisciplinary organization drawing expertise from diverse area of fields. The inclusivity has facilitated a more comprehensive approach to burn care, transcending the boundaries of individual medical disciplines and encapsulating a whole holistic spectrum of knowledge and practice, despite the shortcomings and the problems that is faced on a global level and has been successfully described by my previous speakers. And this slide in front of you, you can see the possible outcome of an 85% full thickness burned patient that 2 to 3 years later was giving a show on the Sweden Got Talent, and the show was watched by 50,000 people. And also, as has been said by my previous speakers, and you see one of the slides here is also the same as Dr. Rajiv Ahuja was underlying the problem in Africa and India. And the trajectory of burn care progress in well-developed nations has provided a noteworthy illustration of the advancements that we actually have achieved. Notably, both the incidence and the magnitude of burn injuries had exhibited a declining trend, largely attributable to robust preventive measures And as previously said, this has been done mainly in the high-income countries, but also tendencies are seen now in later times for the developing world. Nevertheless, the landscape remains disparate, and a substantial portion of burn injuries concentrated within developing countries. Even in high-income nations, burn-related afflictions predominantly afflict populations within economical disadvantaged strata, as was presented, for example, from Canada by Dr. Cartuto, and notably affecting elderly individuals residing in impoverished communities. The ISBI vision and mission has been one world, one standard of care, and ISBI currently endeavors are emblematic of its overarching vision, encapsulating in the maxim that I was saying, one world, one standard of care. This encapsulates ISBI profound commitment to extending uniform and high-quality burn care on the global scale. The organization's central focus has shifted towards the prevention of burn injuries, imparting education on cutting-edge treatment modalities, particularly within low and middle-income countries. As was also alluded by my previous speakers, the NGOs has been addressed and approached by the ISBI to try to help them in their quest of improving burn care, and also trying to support the infrastructure that they have already started and been successfully working in the different fields. Aligned with its mission, ISBI has strategically positioned itself as a crucible for disseminating innovative methodologies for burn injury prevention and treatment. By concentrating efforts on low and middle income countries, ISBI will seek to mitigate the unequal burden of burn injuries carried by these regions. While advances within well-developed nations underscore the potential for collective success, ISBI spotlights on the low and middle incomes. It underscores the need to address the specific challenges that hinder the optimal provision of burn care in those parts of the world. In summary, then, the International Society for Burn Injuries serves as a vanguard in the realm of global burn care advancement. And with a storied history since its inception in 1965, the organization's evolution from a physician-driven entity to a multidisciplinary force underscores its commitment to comprehensively addressing burn care complexities. Through its resolute emphasis on standardization, prevention, and education, ISBI tries and remains steadfast in its mission to establish uniform excellence in burn care across the globe. Having said that, I would like to thank you for your interest and turn the word back to Tina.
Thank you very much, Dr. Sjoberg, for the ISBI perspective. And our next speaker will give the perspective from Mexico, and we'll have Dr. Sjoberg leave or stop sharing so that Dr. Miranda can start sharing. Thank you.
Good morning, good afternoon, good evening to everyone. I'm Ariel Miranda from Mexico. I'm plastic surgeon and the chief of the pediatric burn unit in Guadalajara. And now, actually, I'm the general secretary of the ISBI. Thank you, Tina. Thank you, Kevin, to put all this lecture together. It is very important for us to continue with the effort that we begin since last year with the MIBO people and the APEC to make the things happen. Now we are on the way to have the things going down. As Dr. Folke said, our mission of the ISBI is one world, one standard of care. Burns globally are a public health problem. We have a very few facilities in all over the world to take care of burn patients. We have a very low prevention campaigns doing formally around the world. And actually the cost of the care for burn people are very high. One of the main, Dr. Foki said, is to have the knowledge and stimulate prevention in the field of burns. We endorse regional and national meetings and congresses. The APEC, as you know, we have a lot of countries around the world in the Pacific area that have this economic cooperation, but some of them are not a very high income countries. We have to take care about them with this collaboration. Our goals is to assist with the organization and financial support of educational courses in different countries, but not all. We have to be careful in what countries we are going on. Collaborate with the WHO as a non-governmental organization, and remember that the low-income countries are favored to be members of our society and be attending courses and congresses. Why it's good to be part of this or our society? You have continuous courses online, and also you can have the Burns magazine that have all the scientific articles to be on the day in burn care. One of the biggest challenges of the treatment of the burns is the cost they generate. 2,500 US dollars per day. And if we can imagine people who have a 20% burn in the surface area, have to stay at the hospital at least 20 days. So we have to be very careful with the cost. That's why I'm saying that the burns are a public health problem around the world. Most incidents that result in burns occur in lower socioeconomic strata. So that increase that problem. And the lack of basic services favor these incidents: safe stoves, water heaters, temperature regulators, among others. I'm very punctual to have safe stoves. If we can get it around the world, the number of burns are going to go down. Somebody who to say this, the economic population in the APEC members are very, very, very high. You know, China, United States, and Indonesia have a lot of the total global population. So we have to take care of them. China, for example. India is the other one that we can do something there. We saw the presentation of Dr. Rahib, and that they have a very, very serious problem with burns there. Our strategies, like Mr. Kevin should say, is the creation of online platforms to share the basic knowledge of burn management and with an standard. But we have to be very careful to have an accessible standards that everyone can do it, not the most innovative or the most commercial things. We have to look for the basic and accessible standards. These platforms will serve to provide specific courses in the essential areas like surgery, nutrition. We have, I'm very punctual with nutrition because marks the difference between life or death in burns. Infectology, rehabilitation, psychology, among others. So now we have with us the biggest economies in the world: China, United States, India, Japan. We need you. We need all these economies to help the others. Please, in the help, use this for health problems. Our society supports scholarships to attend face-to-face courses and congresses for health professionals from the nearest areas. And we need to try to improve the conditions of the facilities in these areas where these patients are treated. We need to improve that areas and have the less and the basic things to take care of the burn patients. So this is a little proposals from the ISBI to the APEC to make the things happen, to make the difference between before and after this cooperation. Thank you very much and see you soon. Prevention. I need to talk about prevention. Prevention is very important because more than 90% of burns may be preventable. Remember that. More than 90% of the burns may be preventable. That's why I call incidents and not accidents. The society now has over 100 members representing 95 countries on all continents. We have to work together. Thank you.
Okay, and if you'll stop sharing, I will give some concluding comments. All right. Okay, can everybody see the screen? Okay, we'll try and expand this. There we go. So we've heard from experts around the world in burns today. What do we do now? We now know the problem. The problem is that burn injury is costly in human capital and economic capital throughout the world. They're due to social, environmental, and economic reasons, and they are a threat to our sustainable future. We've taken the first step, and this conference is part of that first step. You have to identify the problem in order to address it. So the solution to the burn problem is the theme of this conference, which is creating a resilient, sustainable future for all. By addressing burn injury, you are actually addressing a microcosm of the socioeconomic problems of the world. As Dr. Rollins said, burn injuries affect everybody, everywhere at some time, and helping to prevent them is part of our mission. How can we build resilience? The famous phrase, an ounce of prevention is worth a pound of cure. The best burn outcome is to never have a burn. Is to never have that your thumb burned on Christmas Eve and have that impact the rest of your day. Creating an infrastructure that prevents or mitigates burn injury can help decrease the incidence of burns in a country like India and lower the use of medical resources. Can we use technology and innovation to improve care? Rather than investing in a computer game, invest it in something that improves the medical care of people who really need it. Help support hospital systems and the people who take care of the patients with education so that they can help take care of those disadvantaged populations. And providing resources and systems to assist in burn disaster is very important. What about the environment? Climate change is the driver of many of our problems in burns. It's the creator of many of our burn disasters. They're increasing in time. If we have to address the climate to help and do that. Support housing initiatives that are fire resistant. You know, in many countries, fire alarm tests are commonplace and irritating. But think about it. There are countries that don't have fire alarms, so there's nothing to test. And that type of prevention does not occur. So we can leverage technology and make it readily available to people to help decrease the injury and support programs such as burns that treat the most vulnerable. We're a microcosm of what's really happening in the rest of the world. And finally, advancing inclusive policies. We can all have that one standard, but it's going to take some work. Let's support efforts to enable uniformly good burn care in all economic strata. And that goes from prevention through education and further population management. Let's invite the diverse stakeholders to the table. We can only know what people need by asking them and then deciding how we can best serve the most people. And as I said, prevention, supporting those injured. Together, we can make a difference, and this conference can be the nidus of making that difference. I want to thank all my speakers, and I would like to thank Kevin and all of the folks for giving us this opportunity to share the burn world experience. Thank you very much.
Thank you, Tina. Thank you, everyone.
Yeah, thank you, Tina. Thank you, Kevin.
Okay, I appreciate everybody coming through. We're making a recording, and this was fabulous. I really enjoyed hearing everybody's perspective, and I hope we can do this again and even in different form. I think this was fun.
Yeah, I think
I agree.
there will be
Very well done, Tina and
additional-
Kevin.
Thank you. There will be additional dialogue carried after this because I think this is really very significant conference, and especially this is one of the most important virtual sessions we are being holding throughout the APEC. Thank you all for being here.
Thank you. Have a great day, everyone.
Thanks, Tina. Take care.
Thank you so
Have a
much.
great day.
Thanks, Tina.
Hi,
Thank
everybody.
Kevin.
Bye.
See you soon.
Bye.